Hello friends, today we're going to talk on de Quervain's disease or de Quervain's tenosynovitis. It's actually a reactive thickening of the sheath around the extensor pollicis brevis tendon and abductor pollicis longus tendon. These two tendons are the tendons of the first extensor compartment, and it's usually initiated by the overuse and sometimes spontaneously. Overuse of the thumb causes the friction of these two tendons, extensor pollicis brevis and abductor pollicis longus tendon, over the radial styloid that results the thickening of the sheath and initiation of the inflammation. Now, clinically, it's common in women around 40 to 50 years and sometimes around the pregnancy, and person present with the pain over the radial side of the wrist. There can be history of overuse of the thumb, like wringing of clothes, and pain aggravates on increased thumb activity. Sometimes person may present with a visible soiling over the radial styloid process. On, on examination, there is tenderness over the radial styloid process, a hitchhiker sign, which is a resisted thumb extension being painful, results a hitchhiker's positive. But the most important test which we do in the clinical setting is a Finkelstein test, and it's a pathognomonic test where the patient holds the thumb in a fist surrounded by the other fingers, and this fist is held by the examiner's hand grasped tightly in adduction and asks the patient to make abduction. This results into pain around the radial styloid process, and this is a positive Finkelstein test of pathognomonic sign. Now, when the person present with pain in the radial side of wrist, there can be a differential diagnosis of arthritis of base of thumb, sometimes scaphoid non-union, and the intersection syndrome. Treatment, arrest is the most important aspect in the treatment. Is the cause is a friction of this tendon over radial styloid. Any aspect that provide rest will reduce the friction and provide for the pain relief, and NSAIDs can be used for early pain management. A thumb spica splint is important to maintain rest and splinting of the thumb so that the frictional activities of extensor pollicis brevis and abductor pollicis longus is reduced. Now, the corticosteroid injection to the tendon sheath can be useful for early pain relief. Sometimes there can be a resistance case where the surgery is required for slitting the tendon sheath. To, and on such surgery, care should always be taken to preserve the dorsal sensory branch of radial nerve. Intersection syndrome, which we talk in the differential diagnosis for de Quervain's disease, is also known as a crossover syndrome or peritendinitis crepitus, where there is a friction between the two tendons, that is abductor pollicis longus and extensor pollicis brevis, and this differs from the de Quervain's disease where there is a friction of these two tendons with the radial styloid. But in case of intersection syndrome, these two tendons friction with itself each other, and usually associated with the tenosynovitis of the tendon of a second extensor compartment. A person present with a pain, swelling, and crepitus over the tendon of extensor pollicis brevis and abductor pollicis longus, which is 4 to 6 centimeter proximal to extensor retinaculum, unlike there is a pain over the radial styloid in case of de Quervain's disease, and it's common in weightlifters, canoeists, and rowers. Treatment is similar to that of de Quervain's disease. We use rest and NSAIDs and splintase and steroid injection. In case of resistance cases, may require a surgical widening of the extensor compartment and exploration of intersection. So this ends, and I hope it was helpful. Thank you.